Okay, I'm doing the appendicular portion in this video just because I was having trouble putting it together. So this is the appendicular portion of the skeletal system. Start with, you have the clavicle right here. Obviously there is a sternal end and a acromial end which attaches to the scapula. Based on the curvatures of the clavicle, one goes anterior and one goes posterior, so that's how you basically determine if it's a right or a left. After that you have the scapula, which is the flat, basically shoulder blade. You have the glenoid cavity, which is probably the most important part, which is where the head of the humerus, which is the arm, fits into. You also have supraspinatus fossa and infraspinatus fossa, as well as the superior angle and the inferior angle. You also have the acromion, which is the thing which is the portion up top, which is where the clavicle articulates. Next, we have the humerus, which is the arm bone. You have the head of the humerus, and you have a greater tubercle, which is the outer portion of it, or the lateral portion. Then you got a lesser tubercle as well. Also, you have a surgical and anatomical neck up top as well. Towards the bottom, you will have the trochlea. You will have like the trochlea and the olecranon fossa, which is the elbow joint area, which is where the radius fit, or the radius fits in. After that, you will have the radius and ulna, which is connected to each other. There are two joints. There's a proximal and distal radio-ulnar joint, but also between them you'll have interosseous membrane tissue, stuff like that. It keeps it together as well. You have styloid processes on both of the distal ends of the ulna and the radius as well. And towards the end of the radius, you have the articulation facet for the scaphoid, which is one of the first tarsals, which is where your thumb is. So going into the hand, you'll have the hand bones, which are the hamate, lunate, triquestrum, trapezium, trapezoid, pisiform, and those go around. So you have those in there. You have the carpals, and then you have the metacarpals, which are just 1, 2, 3, 4, and 5, one for each finger. And then you have the phalanges, which are the end. So you'll have the distal, which is the furthest part of the finger. Then you'll have the middle, and then the proximal. Going to the next portion of the appendicular is what we'll be going down the body. So we will be going into the pubic area. You have the pubic symphysis right in the middle, which connects both of the coxal bones. You have the ilium, the ischium, and the pubic bone, which makes up the bigger portion of it. The articulation portion for the femur, the head of the femur, is the acetabellum, which are that they have like indents on the outer portion of the coxal bone. The hole in the middle here, the pelvic brim, based on if you're a male or female, will be wider for females because of birthing, and men will have narrower and smaller ones. Next, we have the tibia, obviously the biggest, or the femur, obviously one of the bigger bones in the body. You have the head of the femur. You'll have trochanters up top as well. Very thick bone, and it goes down and has it's pretty long, and it connects. It has like a little fossa towards the end that the patella sticks into as well. And the backside, you'll have the fossa in which the tibia fits into the eminence on top of the tibia will fit into the bottom portion of the. It'll kind of cushion the patella as well as connect to the femur. That being said, you have It's sort of like the radius and ulna. You have the tibia and fibula, which are connected by two tibiofibular joints, one proximal and one distal. And you have interosseous membrane between. You have styloid processes on both sides of these, medial and lateral on both sides as well. You have a few grooves, radial groove as well, and you'll have the facet on the bottom of the tibia, which connects to the talus, which is basically the ankle. That being said, you have tarsals, metatarsals, and phalanges. You have the phalanges, which has a distal, middle, and proximal, just like the fingers. Then you have a bunch of tarsals, which are, you have a intermediate, lateral, and medial cuneiforms. You also have the cuboid bone right in the middle, as well as the talus, and on the bottom is the heel bone, which is the calcaneus. And that puts the entire skeletal system just in a short overview. Thank you.